Allergies can be tough. I know I've got 2 children with multiple food allergies, environmental allergies, as well as asthma, eczema and allergic rhinitis. And I bet if you're watching this, you've probably got similar concerns with your kids too. This is one of a series of videos Mumsnet are making about allergies, so to check out the rest, subscribe to their YouTube channel. Today I'm here to tell you a little bit more about diagnosing food allergies and the testing process. So how many children actually have allergies? To explain about that in a little more detail, I've got Dr. Adam Fox, who's a paediatric allergist, to help us out.
Thanks, Emma. If your child has got allergies, it's really important to remember that you're not alone. Over the last 30 years or so, there's been a dramatic increase in the number of children who suffer from allergic rhinitis, asthma and eczema. Genetics are really important when it comes to allergy. If you've got one parent with allergic problems, then you've got about a 30% risk of having some yourself. If both parents are suffering from allergies, then that increases to around 60 to 80%. But there are some kids who come from families where nobody's got allergies at all, so it's really difficult to predict when allergies are going to arise.
When my son was born in 2013, he was a very unhappy baby. He cried, he vomited, he didn't sleep, and by the time he was about 10 weeks old, he was developing severe eczema. So I knew something wasn't right, and I needed to take him to see a doctor.
And it's really helpful when you come to an appointment with your doctor to talk about concerns around allergy that you bring as much information as possible. Keep a diary of any symptoms that have happened. If you suspect a particular food, bring it with so that there's a list of ingredients, because all of that will help taking a detailed allergy-focused history.
Sometimes getting a diagnosis can actually be a huge relief, because it means you can start figuring out what you do next.
There's 2 types of food allergic reactions that we see. One is known as an IgE-mediated or an immediate type reaction. The other is known as a non-IgE-mediated or a delayed type reaction. We understand a little bit more about the immediate type reactions. These happen when our immune system makes a mistake and wrongly develops a response to harmless things such as food that can potentially harm the body when they happen. They involve the immune system producing something called immunoglobulin E, which is an antibody. And when you eat something that you're allergic to, the immunoglobulin E recognises it and causes your body to release a chemical called histamine. Histamine is the chemical that causes the symptoms that we're all familiar with of allergic reactions, and in the most extreme form, the potentially life-threatening condition called anaphylaxis. Non-IgE-mediated or delayed type allergies are less well understood. They involve a different, slower-acting part of our immune system and don't involve the allergic antibodies that the other sorts of reactions include. Cells in the immune system recognise foods that you're allergic to and produce chemicals that lead to a whole range of different symptoms, typically some hours after you've eaten them. This can make it much harder to diagnose because the symptoms don't happen quickly after the food's been eaten.
If your GP suspects your child had an IgE-mediated reaction, which means an immediate reaction to food, drugs or another substance, then they'll refer you onto an allergy clinic where you can get more testing.
And there's 2 tests that we perform very commonly there. The first is a skin prick test. It's a very old-fashioned test, but a very reliable one. What it involves is putting small drops of the different things that we suspect that your child might be allergic to onto the forearm, and then very gently prick through that drop into the skin. That means that the immune system that sits just under the skin gets to see the protein in the extracts that are on the arm, and it tells you what it thinks about it. If there are allergic antibodies there, then within 10 to 15 minutes, they'll come up with a little red bump. And the size of that bump relates directly to the likelihood that you're allergic. It's important to mention that just because you get a positive test, it doesn't mean that you are allergic, nor does it mean if it's negative that you're not allergic. You have to interpret the result together with the clinical history. What's happened when there's been an exposure to that food? A blood test is just as reliable, it's as sensitive and specific as a skin prick test, but sometimes it's helpful to have 2 pieces of information rather than one in order to make your decision as to whether you think somebody's allergic or not. We do allergy testing on babies from very early infancy, and it can be very helpful and reliable.
So my children have both been tested yearly when they're young. This gives you a chance to see if they may have outgrown an allergy, if you're able to start reintroducing a food, or just if anything has changed. As they get older though, and the likelihood of them outgrowing something decreases, these visits to the allergy clinic will probably become less frequent, and you may go to 3 yearly or even beyond that as they get into adolescence. It can feel really overwhelming, lonely and upsetting to see your child in pain or to watch them have a bad reaction. But keep going. Find the right help, get that referral to the allergy clinic, and you will get to the bottom of it eventually. Once you've figured out the diagnosis and the testing, then you can learn how to move forward and how to manage it in your everyday life.